Ed, do you want to give a quick overview?
Sure. Hey, everyone. It's been a busy couple of days already. So one of the things I did was, and I think you all saw it, I was able to decipher and give you a chart on ages and also the amount that we're clearing. We actually have been working with Red Cap to clear out those final cases that had gone to the BU students. Got a few more to work on. Interesting thing happened on Friday. So Amy Childs, one of the nurses, I assigned her to the residents at Valley Farm cluster. And interestingly, what happened was one of the staff members' names popped up and she saw that they were linked to another facility in Worcester. So after doing a little digging, what she found was this employee was working at an assisted living in Worcester, tested positive, but so wasn't going to work in Worcester, but came to work in Ashland. So therefore exposed people that have now since tested positive. Then what we also figured out was another staff member that was exposed now in Ashland worked at a different assisted living in Worcester and created another outbreak there. So what we did was we consulted with the Department of Public Health, and they have a specific epidemiologist that's now looking into this. And, basically we're calling her patient zero for this cluster that created. But again, it's complete. We definitely passed off the information to the appropriate people. But it was interesting how we were able to track all that down using the Maven system.
Are these people working elsewhere too?
I'm sure.
They all work somewhere else, correct?
No. Do they have a third place to work? So we may have to caution the other place too.
No, not that we know of. And we've been in contact and
with that said, I want to make sure we kind of keep the meeting going. I just want, if we can stop right there, because that's kind of where we were at last week. We were talking about facilities doing testing. We took a vote. So I kind of want to segue that over to Michael so he can just fill you in. We had a conversation with Lisa, and I think this is a perfect opportunity.
Perfect. Yep, absolutely.
Okay.
You need to unmute yourself, Michael.
All right. Looks like I'm good. So as the board had requested, where the board voted to look at mandating these facilities, these long-term care facilities, assisted living facilities, and rest homes to test their employees to ensure that they are not carrying COVID-19 and actually unwittingly bringing it into the facility that they're working in. So Attorney Mead started working on this right away. So I think I want to preface, before I get into her conversation, I just want to preface it by saying that, from a legal standpoint, anybody can do anything. That's, one of the unfortunate or fortunate things about the system of law here in the United States. The question is, and the Board of Health could actually take their authority and make most anything that they would feel is important. The question becomes is how challengeable is that, and what kind of exposure does that leave the town with? And so what Attorney Mead has been trying to do is really trying to craft something that accomplishes the goal of what the board and myself were trying to accomplish, but also at the same time limits the exposure. So she did come up with the latest draft, which I believe was sent to the board.
Yes, they got it today.
And I do not want to go all through it. It's a couple of pages, but the order encompasses a lot of other things we didn't really discuss at the last meeting, but also help us meet the intent. But I think the most important piece is point 7, which is provide testing of staff members with symptoms consistent with COVID-19 or those staff members who request tests, and then follow all applicable CDC and DPH guidelines related to any staff member who tests positive, and report all possible cases to the Board of Health. So that was Lisa's way of really kind of limiting our exposure while meeting the demand that we wanted, and hopefully ensuring safety of the residents and the staff there. Any questions so far?
I was just gonna say, did everybody get a chance to read that document today?
Yeah, I thought that the BOHS, the authority here, because I know that there has been an ancient case which went up to the Supreme Court and which asserted the Board of Health public health issues higher value than vaccination or inoculation or something like that. That was way back over 100 years or 150 years ago.
Yeah,
that was the case from Massachusetts too, of course.
So this thing that happened on Friday, Ed, and Mike, this regulation is something, if we can find a way to address that within the body of this as well. I'm going to give an example of our friend's mom just passed away from a nursing home in Framingham.
Oh, I'm sorry.
One of the nurses taking care of her also works at the place right over here in Hopkinton on 135.
Mm-hmm.
Forget what it's called. So
Golden Pond?
Yeah,
no, it's not an assisted living. It's gracious living. It's right near
Okay.
Weston Nurseries. So most of these workers, because most people aren't giving them full-time jobs, so they don't have to pay benefits and, you know, yada, yada, yada. They have under 30 hours a week or whatever. They work at 2 different facilities, sometimes 3. So, and sometimes have private patients on the side that they are employed by. So all I can say is, if there's any way that we can put anything in this document that if anybody in your facility works at another facility, have they been tested there? And if not, you know, find out. Like, I don't know, I'm just like talking off the top of my head right now, but I really feel that, you know, maybe we can close this loop that you uncovered on Friday, sort of kind of by mistake, Ed, but you know, you wouldn't have found it if it hadn't been for that caretaker. So I think this problem is bigger than we can last through it, but if we could put something in that document, Mike, I don't know. Feels
so something like a mandatory disclosure.
I'm not the legal person, but you know, I know that they're working at more than one facility in the greater amount of the cases, I believe.
Right, but the facility which tested should need to inform the other facility saying that, yes, they've tested, or the person who got tested should come and
And I'm going to make an assumption call here that this is like bigger than us, because we wouldn't be able to, let's say Framingham, we can't require Framingham to notify us, but when we talked to Lisa very much an extent about this document today, she was concerned about the employer, you know, like relationship, if you will. So this was as strong as she was willing to go with the document. I think, Michael, you would concur with that. I mean,
well, yeah, she started off a little softer. And you know, honestly, I feel like we should push the envelope a little bit more than what's in this document, but you know, we're trying to find that balance against what we're trying to do and what we're trying to accomplish, and you know, reaching a point where it almost becomes counterproductive. So I feel.
Ed, I have a question for you.
KG, I just want to point out one thing though, everybody too. You know, and I think I mentioned this like 2 weeks ago. I think I had mentioned, I said, I assigned a particular nurse to these clusters, one nurse. And that was why we found this, because instead of having multiple people working on, you know, one facility, you have one person concentrated. That's how we found this. Just good investigation work. I do know that the residents at Valley Farm has instituted a policy, anybody that does test positive is not allowed to come to work at all. I know they've done that.
But
Go ahead, John.
no,
Go ahead,
I-
Jen wanted to say something.
So, Ed, isn't part of the intake for Maven though? Aren't you asking, do you have another employer? Like, so if somebody is saying that they were at work within the last 48 hours of when they showed symptoms, aren't they being asked if they have another job, and wouldn't you then be notified, or no?
No, that is not. So that's the interesting thing. They're supposed to, when they're interviewed, they're supposed to tell people who they've been in contact with, but we think that was not done.
So can we, well, at least on our end, we can add an extra question, but can we advocate to DPH that that's part of the required intake? I mean, that's relatively straightforward.
Well, honestly, the solution, I already know the solution. It's just getting the state to do it. What the solution is that every long-term care facility should have access into Maven, and they can look up their own employees. Right. Now, I will tell you, that is what Waterview Lodge has already done. So last Tuesday, Waterview Lodge got access into Maven. So now they can see their employees that are tested and their results.
But I mean, it took a lot of pushing and prodding and DPH involvement to do that.
Correct.
And Ed brought up the policy that residents at Valley Farms just instituted. And they also have gone one step, and I think this is a good opportunity to publicly commend them. Any employee that refuses to get tested is not allowed to come to work. So, I mean, I think, you know, if all of our facilities had that mindset, I don't think an order would be necessary. But I feel like we don't, not all of our facilities do feel that way. So that's what we're trying to accomplish.
The question I had with Ed was that DPH doesn't have, as of now, a system where they know a particular employee is working in how many facilities. Do they have a record of it?
They do not.
Okay. So it may be a suggested thing to tell them also to make sure that they know it, so that once it gets logged on to Maven, then they can probably trigger the other facility saying that this has happened.
Well, why don't we just say at this point so we can move on? We all recognize.
Sure, definitely.
But I just think, you know, maybe Ed and Mike, and if you want my help, call me tomorrow. I'll, you know, help in any way I can.
Yeah.
You know, it's funny, this is a bigger creature than any of us even ever expected,
Right.
Every day, I uncover something different, and again, this morning at 11 o'clock, they changed the regulation when people can now go back to work and that they're unquarantined. I think I told you before, if you test positive, the public health nurse can check with you 7 days later. And if you've been symptom-free for 72 hours, you're considered clear. That's now been up to 10 days. So it's now matching, regular citizens are now matching the healthcare worker protocol, effective today at 11 o'clock.
So is everybody,
the question is, do we want it to be stronger than this? Is that Michael
I
prefers?
prefer it stronger than what was proposed. I don't know if Michael does.
and I know Michael and I probably have a little bit different view on this, but I do like knowing I have town council's backing on me. And when we talked to her today, she, like Michael said, she was a little lenient on it, and Michael pushed, which is good. And this is, I'll say the most she would do. Again, if guidelines change tomorrow, we could be having this discussion again, but based on what's going on, this is the strongest that she would support us in.
Where she felt like that was in her comfort zone.
Right. Well, there was a lot. I mean, I don't need to get into it, but there was a lot that she get into, including about civil rights. So we don't want to get into the logistics of the conversation, but there's a lot that we need to protect ourselves from, but enforce what the board decided to do last week as well.
But the employers can state the fact that if there is an issue of this, they cannot come there. That's all they can do. They can say that. Again, I don't want somebody who I employ come here and then infect anybody else. I'd say, no, I don't want you to come here. That is in their right, because their business, their profession, their people who they're managing are being affected. So they should be able to say, no, I don't want you to work here.
Could I make a recommendation?
Absolutely.
My recommendation would be that the Board of Health go ahead and adopt this order as it is. We'll continue to refine it. If better changes come out of that, we can present that back to the board. Judy, I think your point about, I'll call it just mandatory disclosure if you're working at another facility is a valid one. And I'm going to see if we can get that included. And at the same time, concurrently, I think we got to start advocating to our state officials for, some level of legislation, or if it's on the executive office side, regulation that really makes something like this unnecessary.
Michael, not only disclosing the mandatory disclosure of working place, they also have to declare that they have notified the other working place about their conditions. That's important.
Okay.
Because I may say I'm working at such and such a facility, but I may never tell the other person.
It's going to be tough not to really get into it, because what the town's purview would be over is the facility, right? And so now we're talking about extending that purview directly to employees of that facility. Mm-hmm. That makes it a little bit more complicated, but we have to see what we can do.
If I can say something, everybody's points, I think, are great points. And we can microanalyze this to death. And the thing that we found out, we've seen this all along, is this thing changes. And Ed, you mentioned it earlier tonight. This thing changes every minute. And so last week we passed an order about face coverings, and the governor made a new state mandate the next day that goes into effect tomorrow. So I think that it is probably more beneficial to put something in place that we know we have. And I agree with Diane's statement of having the legals backing. At the end of the day, if this comes to, a fight, she's the one that's going to be sitting in the courtroom, defending it. And there has to be some merit to that. So I would agree with Michael. I'd say let's pass what we have, and as we have been every day of the week, keep track of what's going on. And if we need to amend it at our next meeting, we amend it at our next meeting, or when it feels like we can move forward. And I'm guessing Attorney Mead is on retainer so that we can continue to budge her and say, well, how much stronger can we get? Yeah, we even had that email, Diane, that you sent from a resident wishing that the fines were more, Oh, yeah. So
the other question that I have to Michael, because most of the litigations that happen with the town or from the town are all based on what the Board of Selectmen feel it, because they are the ones who drive the safeguarding the boards here. Have they cast any opinion on this one?
No, they definitely, in individual conversations with them, they support the overall concept, have not discussed the order with them. I can tell you generally that they are supportive of Attorney Mead's opinions, and usually fall in line with those.
So they will they will back up us for any litigations.
Yeah, this is one, I think it's important. And like I said at the beginning, there's the legalities of things and the exposure of things, it's on a continuum. And I think this is one where, the right thing to do might not be the most comfortable thing to do from a legal standpoint. And I think we should push the envelope. But having said that, what's before you is something that Attorney Mead is comfortable with. And I feel comfortable with saying that the select board would be comfortable with it.
Okay. All right. Thank you for that.
I mean, you would also think, just from a human standpoint, that when that person found out that she was the cause of an outbreak in multiple places, that I agree with you, it would probably be a non-issue in the future, but I agree with Judy to be as tough as we possibly can, without, like you said or Diane said, going overboard, just because, it's other people's lives. I realize it's their livelihood, but
it's amazing that we have to talk about, like, in a life or death situation, which
Right.
very well could be protecting somebody's rights to not tell us that they have it, and they can't work there, but they'll come here because we don't know.
Right. Yeah.
It's wrong. It's just
I'm-
wrong.
Knowing the situation that this particular staff, I'm sure that person is aware that how things are going to go bad if she goes around. So she's aware of it, what the consequences for other people. So that's
I don't know
where
how you can't be aware of it these days. So just to circle back, so is everybody in favor of adopting Lisa's emergency order?
we need to propose and then vote on it, isn't it?
Correct.
Okay. Can I make a motion to adopt the updated version of the regulations?
Emergency order.
Emergency order
I'll
as
second that.
presented.
I second that.
I think Chris already did. Did you, Chris?
I did.
Yes.
Okay, I didn't hear me, so I apologize. All right, all in favor?
Aye, KG.
Hi, Chris.
Aye.
Hi, Judy. And if we could see if we could, going forward, toughen it up to include,
Okay.
Sure.
So with that said, last week we did take a vote on the face masks. And I spoke to Lisa again today about it. And so the governor's order supersedes our order. So what we should do to keep in line with the governor is we should adopt the governor's order. His order is, there's two parts of it that's a little bit different. First part is his order says age 2 and older, ours was 5. And his is specifically addresses the fining, which is the non-criminal disposition, which we spoke about last week. The way that it's worded in his order is the civil fine of up to $300 per violation. Our tier is 100, 200, and 300. So that's what our fining would be under this one, which again is in line.
The other question that I have for Ed.
For you.
Ed, one of the neighboring person here complained about, when they were walking in, they had the mask, and the other person who was coming on the other side did not have the mask to walk around. And this person says, how would I keep a safe distance from that person when that person is not, and she cannot cross the road because the cars are coming on the other side? How do we protect ourselves? That is a question that that person had. So how do we answer that person?
Did you want to say something, Michael? No, okay. No, when you read the governor's order, and I've been talking to a lot of people, so the governor's order really says, so for example, if you're walking down the street and it's an empty sidewalk, you don't have to have a mask on. But what they do say is that if you are going to be in an area where you cannot keep that 6-foot distance for greater than 15 minutes, then those people need to have a mask on. So you figure if we have a lot of people at Ashland State Park, obviously they'll have to have masks on because there's so many people there. But just, for example, walking down, Chestnut Street, the way it's written, you don't need a mask for that. But then when you go into any public building, you need a mask.
I understand that. The specific question was when walking on the street, somebody's coming on the other side, other direction, they walk by you.
Well,
You have no means to cross over to increase the distance.
Well, I'm going to answer it for you, Ed, because I'm sure you can't solve everybody's situation. I mean, obviously you have to take whatever means possible for you to get 6 feet apart from them. If Ed says step out in the street, people need to use their own judgment, whether it's step into somebody's driveway or whatever the case may be. I mean, sometimes it's not physically feasible, so you need to make different accommodations. Because I know I would. If I, wanted to stay 6 feet away from, I would enter into somebody's driveway or go to a different area.
Yeah.
So,
and then the other thing too, remember, there are those people that are going to have that medical exemption where they're not going to have a mask on.
Mm-hmm.
You're not going to say, walking down the sidewalk, I'm not, if it was me,
Right.
well, I have a medical, I'm just going to keep walking,
Right.
Unfortunately, it's one of these, we can't fix everything.
Correct.
We can just do the best we can.
Right.
All right.
Diane, can I this is actually something related. Can I?
Yeah.
So Judy called me this morning and there was an issue at Market Basket with the Instacart people. So what I did was I sent Mark over there to kind of hang out at Market Basket and see if there was an issue. There was a couple of minor issues with the Instacart people. Mark did have conversations with the manager on what some of their options might be. So the manager actually went around with Mark for over a half hour and they were checking different things in the store. So I just wanted Mark to give a quick report on that, just to kind of keep it all in the flow together. Plus also this afternoon, I asked Mark at lunchtime, I asked Mark to randomly go to 5 or 6 different restaurants to make sure everybody was in compliance. I figured lunchtime, it's busy. And so I just want Mark to be able to give that quick report to you guys on what we discovered today.
Great.
You ready?
Yep.
All set.
Okay. Just want to make sure. So I was at Market Basket this morning and I met up with Tim Harris. He's the assistant manager. And we discussed, which I never knew what Instacart was, which is people go out shopping for other people. And Ed gave me a little advice on how they could be recognized. And basically they actually come up to them at the time we were there, they came up to the assistant manager, a couple of them, with their phones asking how to find certain products. So that's how he said that's one right there. They usually have their phone out and they ask about products. When I was there was basically probably 2 or 3 people that improperly had their mask on. They were kind of sliding down to their nose. Seems to be one of the major issues no matter where you go is people wear the mask isn't properly worn. So with Tim and I, we advise people make sure, including employees, that the mask is up over the nose. And unfortunately, the cloth masks that are being made sometimes slip down too easily, but they can be tightened up. So that was, there was only one person in there that didn't have a mask. And he said he left it in the car and was confused. He said, well, that doesn't start until tomorrow. And we informed him that the town had a local regulation at the time. So he went out to his car to get his mask. Everyone was very polite. Management was very much involved with the whole process. And I would say as a whole, they had sufficient compliance and with a couple needs for even their own employees to wear their mask properly. So they were doing fine by the end of the visit.
And I'll just add in one other thing. So the main manager, the general manager of the store was off today, but I actually have a meeting with him tomorrow morning. So I'll do an additional follow-up with him just to make sure everybody's on the same page at Market Basket.
And we did suggest, well, I suggested to Tim Harris, the assistant manager, that if the manager had any questions, he could call. He's very involved with everything, which is important, as well as the PSAs to make sure their PSA machine is not working. So to make sure that they have their clerk or whoever does the PSAs, public service announcements, to continue mentioning mask use, facial covering, as well as social distancing, so that people in the store can be reminded. I ask that be done every half hour. And if they could consider more than just English, if they could do it in 2 different languages, whatever the languages are that are spoken. And according to Mr. Harris, Spanish would be the other language that they can do those 2 PSAs with. And Ed, if you can bring it up to the manager as well, that would be great.
In fact, I had called Mark as well as sent a message on Sunday morning about Market Basket and Shaw's. So Shaw's was not having anybody counting the number of people inside, and then they rectified it by the end of the day. I guess I had gone afterwards. My wife had gone in the morning and I had gone in the evening to check on it.
What about the restaurants, Mark?
Yes, if I could, and then from there I went to Big Lots because the line went down. Believe it or not, the line for Market Basket, which they're using small cones, to keep people 6 feet away, all the way down to Big Lots. So I went into Big Lots, and what happened there is I provided them a sign from the Board of Health. They didn't have the door sign, so I gave them a sign and just went over. Everything seemed fine in there. The only thing I did ask in the grocery area that they put some directions on the floor, making aisles one way. They were very limited in people. They might have had 4 or 5 people in a store during my visit. And then from there, I did some checks at Pizza Mine, as well as Nick's Pizza. Went over signage with them, and all these places, so I don't have to repeat myself, we went over signage as well as appropriate mask use and the markings on the floor, as well as making sure there's no availability for dining areas to be open. So if it appeared to be open, I asked that they either use some type of tape or rope to make sure people understood their entry in and their entry out was just for takeout. And so all these facilities, and I can mention them. I mentioned the 2 pizza places, Cherry Blossom, Pizza Bella, Lucky Farms, also Darragon Noodle, Marathon Market, Han 2, Tomorrow's, CVS on Union Street, Walgreens on Union Street, and Mexico City. The 2 coffee shops on West Union Street only have drive-through. That's the Honeydew and the Dunkin' Donuts up on West Union. And yesterday I went to Dollar Tree because they were confused as well about the start date. They said they thought it was this Wednesday. I said, no, the town has a local regulation. So I took care of a concern at Dollar Tree as well. So about 16 or so facilities were visited.
And so for the board's sake, everybody, I'm going to be having Mark do these random audits, and also what I'm going to have him do, for example, if he does like maybe tomorrow or Thursday, I'm going to have him actually pop back into a couple of these places that he already went to, because I don't want them to think, oh, well, we got checked today, so they won't be back for a month. So we're going to try to cover all of our bases with these spot checks. And I'm going to have Mark try to go like during lunchtime when they would be the most busy.
Good. I have a couple of questions for Mark. Mark, did these facilities, when they open, the clients open the door, do they have automatic doors, or do they have to handle? Are they cleaning it quite often?
The doors were not automatic. You have to open the door. One place had the door ajar. There were no flies in there, so that they were letting the nice air in. But most of them, you do have to operate a door.
Yeah, you may want to remind them more often, either through an email or something. And have you been able to get any word on how many CFMs have been fired on any of them, or they still have them?
When I did my visits, the CFMs were on site.
Right, but did you send a general email to find out whether they have fired any CFMs from any of the vendors?
Tom was doing that. Tom, are you on the call right now? I don't know if he is.
No, Tom's not.
Okay. Yeah. So he was doing that. So I know he's been planning to do that. I can find out from him for you, KG.
Yeah. The other thing is I saw the response from Pizza Bella. On the normal course of action, do we let them answer whenever they want, or do we have a time limit for answering? Because there was a big gap between 22nd April and then 3rd May or something. So why were they not answering it soon?
Answering what, KG?
There was a complaint, or there was a request for them to respond. The first last email went on 22nd April, and the response seems to have come up around end of May or the beginning of May.
The call. He was handling that, so I'm not for sure. I know I was out there, not this week, but last Thursday, I believe, maybe April 30th. But I can find out for you, KG. I can check with Tom on Pizza Bella for you.
Do you normally leave them that much time for responding whenever you have an issue with them? For any vendor?
That's why I'll look into the email chain to see when the response was, when they received the email and when they responded.
It was 22nd April. I know that. I've checked through that one. That is all set.
And Mark, the question is, maybe check with Tom. He might have had other communications. It just wasn't via email.
Yeah, no, it could have been. That's why I'll check for you, KG. Okay.
Just because we kind of moved on. Did we actually vote on that? We didn't vote on the governor's order.
We did. It's all up. Which one? That the No, the
yeah, I don't think we did.
No, we did not vote. Okay, can we just? I just don't want to get too far.
Sure.
So is everybody understands what the vote is? We understand where we are? Everybody's good with it?
Yes,
Okay, would somebody like to make a motion, please?
I make a motion to accept the governor's order to supersede the town of Ashland's order. Is that how I should put it?
Yes.
Governor's order number
Second.
31.
Okay.
Already
I'm
second.
sorry, all in favor?
Aye,
Hi,
KG.
Chris.
Aye. I'm laughing because I know Chris commented that we got an email from a concerned resident. I don't know if they're watching on WACA-TV. And if, I know this is bad, but if they are, the Board of Health is trying, working really hard to get through this as well, because I'm getting the not so nice emails in response. So we're working very hard together. All right. Does anybody have anything else related to the COVID-19? Ed, you all set? Mark?
Yeah, I hope the data I'm supplying to you is what you're looking for. If there's a particular data set that you're looking for that I'm not sending, just shoot me an email so I can get that over to you. And like I said, if you have any questions, please just call me, and if I don't know the answer, I'll find it for you.
Thank you.
Okay. Jen and Michael, do you have anything else that I forgot to add in? No? Okay.
Nope.
One more thing.
Okay.
Okay.
I was going to ask, is it possible for me, are you attending the meeting with the general manager of Market Basket in person or by phone? Ed,
I'm going over there tomorrow morning,
what time?
around 8 o'clock.
Sounds like Judy wants to do a site visit.
You want to meet me at 8, Judy?
I was kind of disappointed today, so
Yeah.
I would like to share some information with them.
Sure. Do you want to meet me at 8 o'clock?
No, but I will.
Oh, we can make it, if you want, we'll make it 5:30.
AM? No,
Yeah.
no.
Well, with that said, I know you're going with Ed tomorrow, and I know you've identified yourself, but I did work with IT today. You probably saw the email, so
Yep.
They will get everybody the proper identification if you just send them a picture, and then we can work on getting them back to you.
Okay.
And then just another notification, Ed and I were invited to Yolanda's Around the Clock show on Thursday morning, so we'll be doing an interview. So
Good.
okay, that'll be fun. Thank you,
Yeah.
Yolanda.
I have one general comment that I want to make, and maybe the public would get benefit out of that if that's permitted.
Sure, it depends on what it is, Kate.
Oh, it's very simple. I know the colleges are getting close now. These children must be off the college education, so they should get used to gardening more. So that'll be helpful down the line, because if you have difficulty in getting the vegetables, you leafy vegetables or other easily growing vegetables like eggplant or something, you should start doing it soon now, and then get their garden going.
Okay.
All right, Mark, do you have anything else? Are you all set?
I am all set. I will be asking that we add to the next, I don't know when the next meeting is, but to add to the agenda. We're getting to the point where it's almost time for our usual intern. I have a summer intern that is planning to work with me through the summer on her practicum. So she's from BU School of Public Health, my alma mater, and she will be looking forward to working with us. She just today got the approval through the School of Public Health at Boston University. So I'll be addressing that at our next meeting.
Yeah, we
And
should be on our regular meeting schedule now, so we should
Okay,
be,
and
I mean, as
sure.
long as everybody's good with doing every 2 weeks again.
Yeah, that'll be May 18th, Diane. 19th, right? May 19th.
19th.
Right.
Yeah,
Yep.
I don't know if we'll be meeting in session or probably maybe not, but sooner or later I will introduce her to the board.
Okay.
Well, I mean, if we put it on for the next meeting, I mean, we could wait, or she could join us, because town hall still won't be open, so we'll
Yeah.
be doing another Zoom forum anyhow for that.
Yeah, and I
meeting.
did, that's a good way to do it. And I explained to her she would have to work from her home at the time being because of the fact that town hall is still limited in operations.
Mark, when would she start?
Well, she was hoping to start around May 18th.
Oh,
That's
oh,
why I
okay.
said it. But I told her, I said, unfortunately, you know, the way things are going, and she doesn't mind working out of her home.
Well, I just wonder with everything going on right now, if it, I mean, you know, you and I could talk and, you know, off camera, but it might be a little much right now.
Well, she's very interested in helping us with COVID-19 and studying Nyanza. So a lot of that she can do on her own.
All right.
I guess Mark Dosoni wanted to say something before Diane.
Why don't we put that on the agenda for next time?
Sure.
Yeah, yep.
Which one, Mark Dosoni?
No, I'm trying to be respectful of the department. I see, Mark, that you have a question, but I just want to make sure everybody else is all set, Mark. Okay, Mark Oram, you're all set, correct?
Yes, Diane. I'm sorry. I thought you were talking about me for a minute.
No, that's okay. Mark Dosoni has his hand up in the corner, so, all right.
Thank you, Dan.
All right, Judy, you all set?
Yeah, I'm all set.
Okay.
Are you guys all set with me? All set with me?
Yep, I think we're all set. All right, hold up,
All right.
Mark. Mark Dosoni has a question.
Yeah.
Mark Dosoni, what would you like to
I'll call
ask?
you.
All right,
You need to unmute yourself,
Mark,
Mark.
you're all set.
I got
There
my
you go.
mom down on the TV. I'm getting all my COVID information here on the these meetings, but I'm gonna ask to the chairman, to Michael and Mark, when's the next recorded updates you're gonna do? Like you did for the ACA for every other twice a month. Is there any others? Are there any other updates that you can have town manager and the health agents together bring up updates and record it for the home viewers that don't watch these meetings? That's it.
Well, Michael does them every week, Facebook Live, Mark. I'm not too sure if you see those.
I'll be offended if you don't, Mark.
And this Thursday on Yolanda's, correct?
Yep. Preston, do you have a question?
And aren't there links to all the daily updates that we get on our website? So
Yes.
he can go there and get that information, I'm sure, as well. There's tons of graphs and charts and the updates every day. Have you been doing that, Mark?
He will now.
I have, but then again, that would leave me with no questions asked during the meetings. But then again, I get these updates that were recorded. Last one you and Mark did was early April, like the first and second week in April, and there's been more information coming through here. Why can't that information be recorded a day, 1-2 days after, since it's that fresh, to the people at home only on WACA, because I don't do Facebook, and I do watch maybe once in a while around the clock with Yolanda's show there. But I get it from the ACA updates when it says town manager update, it has the date and both together understanding. That's where I'm coming from on that. Thank you.
All right, thank you, Mark. Preston, you had a question?
Yes, with the issue of somebody who had tested positive going to a residential facility, since we don't necessarily have a way of knowing when someone does that, should we announce that there's some sort of penalty or fine for someone doing that? I mean, it seems like a horribly selfish thing for someone to do, and it's the kind of thing that normally, there would be penalties for doing that. Is that something the board should look at imposing?
And just to reiterate, so you're saying if somebody shows up at work and is positive but doesn't tell anybody?
Yeah, that maybe there should be employers should notify their employees. The town has said there's a $300 or $500 fine for anybody who is knowingly COVID-19 positive who enters this facility
And doesn't report it.
without having been properly cleared first.
We could put that on our list to ask Lisa, again, maybe as things evolve.
Because
I
think what happened is really horrible, and there should be some disincentive employees to do that.
I think we all agree. Thank you.
It's a very good point. That's something I think about too, but I think Lisa would probably have a lot to say about that because I don't know where it fits into disclosure policies and laws.
Go ahead, Michael.
Yeah, I was just going to say, I think we would have to hold the employee responsible indirectly by holding the employer responsible. As Chris mentioned, that one's going to be pretty tough. You know, I agree with you, Preston. I do think it's very selfish for them to do what they are doing if they do come to work sick, especially in one of these facilities. Trying to have a little bit of compassion towards their situation. But again, from my perspective, I think this is a regulation. I think if there's ever a role for government, it's to ensure that the playing field is equal and that we're basically taking into account the greater good, where everybody else is really just focused on their self-interest.
But how do we always do for the tobacco? Anyway, the shop is penalized rather than the staff. Tobacco regulations if there is a violation there.
Well, it's the same fining system that we're using for the case
so
cover.
Then
yeah, but that doesn't address an employee issue.
I understand, but the employer, the one who's responsible, if something happens like this, then he should be fined, and then that person will take care of it, not him continuing with this staff.
I'll just say, I mean, we can just
deal
with Lisa as things go along, I guess.
That's fine. Talk to her and maybe we can come back with it, maybe another regulation. So that'll be good.
Okay. I'm sure Lisa will keep up the speed if we have to take any further action as well.
Right. Yep.
All right. If nobody has anything further, we'll take a motion to adjourn.
Michael, would you call me before that, after that? Michael Herbert, would you call me after that?
Yes.
He can't hear you. Yes. I hope.
He can hear you. Let the guy
have
a night at home and relax, KG. Talk to him tomorrow.
No, today.
I want him to make another guitar video.
Oh, he will.
I make a motion to adjourn.
The second.
All in favor?
Aye.
Aye, Chris.
Aye. Good night, everyone. Thank you.
Good night, everybody.
Good night.
Thank you.
Bye-bye.